Now let's see about diabetes mellitus. It happens due to absence or deficiency of insulin or insulin resistance. There are two types of diabetes, namely type 1 and type 2. Now let's see what are their different features. Onset of type 1 diabetes is sudden, whereas type 2 can be gradual. The age of onset of type 1 is any age but mostly young, whereas in type 2 it is mostly in adults. The people having type 1 diabetes can be thin or normal, whereas those with diabetes are often obese. Ketoacidosis is common in type 1 diabetes, whereas it is rare in type 2 diabetes. Autoantibodies are usually present in type 1, whereas it is absent in type 2. Endogenous insulin levels, that is insulin level in your body, can be low or absent in type 1, whereas it can be normal, decreased or increased in type 2 diabetes. The concordance in identical twins is about 50% in type 1 diabetes, whereas it is 90% in type 2 diabetes. The prevalence of type 1 diabetes is less, whereas it is more prevalent in type 2 diabetes, that is about 90 to 95% of US are diabetic. Some of the symptoms in diabetes mellitus are generalized weakness, tiredness. They can have blurred vision due to diabetic retinopathy. They can have polydipsia, polyphagia. Polydipsia refers to excessive thirst, whereas polyphagia refers to excessive hunger. There can be sudden weight loss. There can be frequent urination due to polyuria. There will be non-healing wounds. In females, it can result in vaginal infections and sexual problems. There can be tingling and numbness of palms and feet due to diabetic neuropathy. Glucosuria refers to excretion of glucose in the nephrons. This will result in osmotic diuresis because presence of glucose in the nephrons will cause forced diuresis. This will result in polyuria, that is frequent urination. Because of increased urination, the thirst center will be stimulated and this will result in polydipsia, that is increased thirst. Then there will be polyphagia. In spite of increased blood glucose level, the glucose will not enter into the cells. So the cells will be constantly informing the brain that they are deprived of glucose, so they want more food. So this will result in increased hunger. Because not enough glucose is there, this will result in asthenia, that is generalized weakness. The diagnostic tests for diabetes mellitus are fasting blood glucose level, postprandial blood glucose, that is it is taken after meals, then glucose tolerance test, and glycosylated hemoglobin, that is called HbA1c. It shows the average blood glucose level for the 3 months. Treatment for diabetes mellitus depends on its type. In type 1 diabetes mellitus, there is either very low or absence of insulin. Hence, it is treated by exogenous insulin. Type 2 diabetes mellitus is treated by oral hypoglycemic drugs like insulin secretagogues, insulin sensitizers, alpha glucosidase inhibitors, and also exogenous insulin. Other forms of diabetes mellitus are gestational diabetes, which occur during pregnancy, preclinical or latent diabetes, and secondary diabetes that can happen due to any injury or infection of the pancreas. Now let's see about hyperinsulinism. This happens due to increase in insulin secretion as a result of tumor in the beta cells of islets of Langerhans. It can result in hypoglycemia, neurological symptoms like convulsions and coma. This is due to hypoglycemia of the central nervous system, and it can result in insulin shock. Moving on to somatostatin. It is secreted from the delta cells of the islets of Langerhans. It is also secreted from hypothalamus. It is synthesized as prosomatostatin and converted to somatostatin 14 in the pancreas and somatostatin 28 in the intestine. It plays a main role in gastrointestinal motility, and it reduces the secretion of other hormones like insulin, glucagon, and some gastrointestinal hormones like cholecystokinin, GIP, VIP, etc. Somatostatin is also called growth hormone inhibitory hormone. It acts through the second messenger system cyclic AMP. It is regulated by glucose level, amino acids, and cholecystokinin. Pancreatic polypeptide is secreted by PP cells of islets of Langerhans. It is synthesized as pre-pro-pancreatic polypeptide. It also acts through second messenger system cyclic AMP. Its actions are not known, but it is believed to increase the secretion of glucagon. Thank you and have a nice day.